Okay. Okay. Thank you, everyone, so much for being here. Wes, can I ask you to go ahead and do roll call, please?
That will be Ashley.
Ashley, sorry.
That's okay. Good morning, everybody. We're going to run through roll really quick. When I say your first name, please just announce if you are here or not. Caroline,
Caroline will be here. She just accepted, so she's coming.
okay, wonderful. Debbie, Debbie's here. Pam,
Sorry. Yes.
Here,
it's okay. You're on your phone. It's harder to
here,
switch over. Pam's here. Frankie,
here,
Lindy,
Here.
Shauna,
here,
Alexis,
here,
Amy Zimmerman, Amy Mullenberg,
here,
Luis,
Here.
Beth, Darren,
I'm here.
and Jessica.
here.
All right, that concludes roll. Back to you, Debbie.
I think we missed Tim.
Well, I don't know about Miss Tim, but yes,
I'm so sorry. I
I'm still
forgot to
here.
add. Nope, that's on me. I will add you right now to my roll call list. Sorry, Tim.
No, that's quite all right.
All right. Again, thank you, committee members, so much for being here. And I know we've seen a couple of things in the chat that some of you might have to leave a little early. We really appreciate you squeezing us in. And again, really want to thank all of our other interested members, community members who are here. Again, I brag. I've been talking a lot the last 2 days. I brag all the time in other meetings. How we get we were kind of rocking the bar for how many people we get that are interested in this work. So I really appreciate that. I do want to do just a quick introduction. All of you are very important, but we have a new prevention champion, and I'm going to let her introduce herself. But she is the fellow from our new fellow from the Prevention Technology Transfer Center. Wimmy, can you just do a quick little introduction? We just want the workforce to know that we've got a new champion joining us.
Thank you so much, Debbie. Can you hear me okay? Sweet.
Yes.
Hi everyone. My name is Wemimo Ayonubi Owemi, and I am the Substance Use Prevention Fellow with Northwest PTTC, and it's housed in Washington State University. And I'm happy to be here. Thank you.
Thank you so much. And we, again, appreciate everyone being here, but I want to do a special shout out with Wimmy as she's going to be a real good champion for us, especially with our transfer center, PTTC. I do not have, sorry, the agenda in front of me, but I know we're going to have updates from Director Dolph as well as Wes. We have a very exciting presentation, no pressure, Third Horizon on the update for where we are with 3321 and the strategies. So that'll be a big part of our update. And we've got something else on that. We're going to follow up from where we were last month. And then before I turn it over to Wes, I just wanted to, and Luis, please feel free to chip in. Luis and I have been talking, and we want, as your chairs, we want to do a better job of, in the future, onboarding new members. Jessica, we so appreciate you coming on board, and we didn't really, we want to do a better job of, as the chairs, onboarding new members, helping you know, hey, this is the process. And we really want all of you guys to know that this is our work. Wes, as our ADPC liaison, he, you might see a lot of things come from him. I really want to assure everybody, not that anybody's thinking about this, but they're collecting what we're giving. He's not putting any other little secret ingredients that he thinks, oh, this should be in here. He is keeping track of what we are asking. And at the addition to our consultants with Third Horizon, this is our strategic plan. This is our charter. And if you ever feel like, oh, gosh, maybe I don't feel like saying something in a meeting and you want to make sure that it gets down, please don't hesitate to reach out to Wes, Luis, or I. It's our work, and I've been on very few committees where I really can say that to the degree it is. So sometimes it might feel like, oh, this is just ADPC trying to get us to do what they want us to do. No. And so I just wanted to throw that out there. And I believe I don't, if there's some of us that aren't on this that are not necessarily committee members, I want to kind of save Wes's time a little bit because this work is so important. I think we could keep him busy just full time answering all our questions. Please feel free to reach out to Luis and myself. Luis, if you want to pop in there too, but we really want you guys to make sure that you realize this is our work at the ground level. Luis, anything you wanted to add to that?
Yeah. Thanks, Debbie, for kind of just setting the tone there. And just to kind of go off what Debbie started, we did have a conversation on scheduling maybe some one-on-ones with committee members, voting members, to make sure we're all on the same page. If there's any questions that need to be asked at the group, because we know this meeting is kind of jam-packed with information and agenda items, that there's always not a chance to review some of the material or have a chance to give feedback to everybody that has the opportunity. So Debbie and we haven't finalized the dates, but we're thinking summer to schedule some one-on-ones with folks together and have those conversations and answer any questions that folks might have and give any kind of clarity. Again, to save some time for Wes and things on emails. But as Debbie said, feel free to email us and we'll get back to you as soon as we can. I know Debbie's really quick at email. Whenever I ask her a question, it's immediately replied. So yeah, open door, and just be on the lookout when we get more information on when we'll be scheduling those one-on-ones.
Yeah, thanks, Luis. And the purpose of that is because, as Luis was saying, we want to make sure you feel connected. And then also with the diverse specialties that we have as voting members, we really want to learn, okay, like Alexis with the college, are we hitting things? Are we utilizing your expertise? Shauna with our early childhood. We really want to make sure, as we said, the meetings are packed, but your involvement, your expertise was all of you. Darren, Dr. Lynch, Tim, I know Amy, I'm forgetting names, I apologize. Lindy, Jessica, I'm trying to remember them all, but please know that I mean you, Pam. We want you to feel like this time that you served on this council, it was worth it to you and you left a mark that is generational to come. So we appreciate that and we want to honor that even more. So with that, unless I've forgotten Wes, anything, let's turn the time over to Annalise Dolph, our ADPC director, and Wes Rivers, the guy who keeps me out of trouble.
Wes, did you have any more comments before I hop in?
No, I'll reach out to individual members. I know you all are very busy people, so like for the connection and scheduling of time. So look out for some like a Google Doc that will capture all of that, and we'll get you scheduled time with Luis and Debbie. Thank you so much.
All right, I'll be quick. So this is my usual Annalise Dolph, Director of the Alcohol and Drug Policy Commission. For folks whom I don't know, we start out every committee meeting with a quick update on commission and other committee happenings. So Hopefully this is information you take away with you. In addition to the information, as Debbie just said, we take in. Earlier this month, the full commission met and heard our first quarterly update for implementation of the comprehensive plan, which is pretty exciting. Yes, the comprehensive plan belongs to the committees, but it's really the full commission who's responsible for implementing and tracking and oversight. And it's pretty good news, even though we have some risks depending on what happens with budget. We are definitely off and running on implementation of the plan. Next month, the full commission is going to talk about aligning the plan to metrics and outcomes of particular funding streams. This is something we're getting a lot of questions about. The Opioid Settlement Board, which I also co-chair and always give an update. We are getting ready to do a pretty broad request for proposals. So really thinking deeply as a full commission about what are the particular metrics and measures that we're looking for those funds to be directed to, and how exactly do we make the determination that it aligns with the plan and is the best use of funding right now. So that will be the full commission next month. Health and Safety Interventions meets next week. They are continuing on naloxone everywhere. For those of you who might be interested in that topic, we're going to hear from our multi-state purchasing program next week. They're really helping us with some of the data and analysis to ensure that we're efficient with our spending at both the state and local level on naloxone. The Recovery Committee continues to talk about recovery community centers, what they are, how they're funded, how we can make those a part of our communities in Oregon going forward. And as part of that, there's some crossover happening between the Recovery Committee and OYA to talk about youth-specific recovery spaces and what that might look like, what defines those, and what best practices would look like. And then finally, the Treatment Committee is going to be talking about a provider assessment and starting to think about some of their future landscape assessment work. So that was a whole lot. Happy to answer any questions. This is a newsletter week. If you're not signed up for the newsletter and you would like to be, please let us know. It is an opt-in. We have some it's not really an interview, but kind of a question and response that Tim actually helped us with, Dr. Lynch, and some other folks down in Coos County talking about kratom and nitrous oxide. And there's always news and upcoming events in that as well. So that's all I have. Let me know if you have any questions. Thank you.
Thanks, Annalise. And just kind of an addition to that, I saw it on, if none of you, or please join the, Pam, I'm going to ask you the official name. I think it's a super preventionist on the Facebook page, because there was an incredible, Pam and Tony Venza, our ADPC chair, were interviewed, and it was kind of more of a recovery. They might have thought it was, but both Tony and Pam brought it right back to the work that we do. And so that's definitely worth checking out. I think the whole part is on the Facebook, but maybe that's something to Pam, maybe if you can send, if you have the link.
I'll share it.
Perfect. Yeah, you guys, it's just, I want you to feel that we're part of the whole continuum. And I really appreciate Pam and Tony, the great job that you did in sharing your stories that were very inspirational and help us feel good about what we're doing. So Wes,
Yeah. One more thing.
where?
Yeah, one more
Thank you.
announcement. Yeah, yep. So this might have come across your desks, and I sent all of the committee members an email about this. Oregon Department of Education's specialists with respect to substance use prevention policy and classroom education has that group of folks within ODE has developed a formal process to start providing advice for the work that ODE does in that space. And that's super exciting because that is directly responsive to your comprehensive plan strategy of working with ODE. And so they have designated 2 seats for ADPC Prevention Committee members with that in mind. We will go through an we're going to go through an appointment process if that's all right. I'm going to send you after this meeting a nomination form. I would like to take nominations. And then Luis and Debbie and I can talk, depending on how many nominations we get, to figure out the best way about selecting those folks. We would need to select next meeting. The hope is to announce in late May the full committee. That would be that advisory body to ODE. But again, I want to tell you that in this way because I think it does speak to what Debbie was talking about. This is your plan. This is what you wanted, and I think this is a way that ODE is reaching out to support us in realizing your vision. So our delegates, so to speak, would be really important in building that bridge, and that would be more of a formal channel for us to support ODE in that work. So that's the last update I have.
Thanks, Wes. And I listened to that and I saw those announcements, and it's like, and it's such a big deal. And I want to call out Wes, not that he ever asks for it, but the work that he's kind of doing behind the scenes to help us be in this position that ODE is saying, oh, yes, we can reach out. We want this. That's a big thing. And I get excited. And it's like, oh, I want to do it. I want to do it. But I think vote. I mean, we want other people on this voting that are committee members. Please don't think, oh, Debbie and Louise are probably, yes, we'd be more than willing to do it, and it's exciting work. But please throw your name in that hat, because this is work that we all need to do together. Are we ready for the big show, Wes? I'm just like way excited for this.
We're ready to go. Tim,
Okay.
are you on? I see you. Okay. Thanks, Tim.
Well, thank you, and good morning, everyone. I'm feeling an incredible amount of pressure, but always happy to take it. So thank you, Debbie, for the leadership and introduction. So for folks newer to the committee, my name is Tim Rourke, Managing Director at Third Horizon. We're the advisory firm that's been working with the ADPC over the last year plus. We were the backbone group that was helping facilitate the comprehensive plan process. So I had the great honor of getting to work with this committee over the course of the last year. And we are now charged with the delivery of the prevention and program inventory and financial analysis that was called for in House Bill 3321 that many on this body helped shepherd and champion through the legislature last year. So our commitment was that sort of on an every other month basis, we would come back to this committee, give you an update on the work, where we're at, might field some questions from you. We might get to places during this process where we have some questions we'd like your feedback on. What I would love to do today, and I'm joined, my colleague Lindsay is on the call, several other members of our team were unable to be here today, but my hope is to be able to give you an overview today of where we're at in the process and highlight a couple of upcoming things where I think your voices and leadership are going to be incredibly important to the success of this analysis. So if y'all don't mind, is it possible, I don't know, Wes, if you have the slide deck I sent or if someone could turn on sharing and so I can share my screen.
Ashley has it and it's ready to go. Do you want her to share? Okay, that's perfect. Ashley.
Yeah, that's fine.
Yep.
Let me just get this pulled up. One moment.
No worries. There we are. Great. Can everybody see that? Thumbs up. I see a few. Okay, great. So we do want to keep it brief because you have some other big discussions to have as a group, and I want to make sure that we don't interrupt the time to do that. So Ashley, if you want to go to the next slide. Just as a reminder, I'm assuming everyone's kind of level set in what House Bill 3321 did broadly. It tasked the ADPC to do a number of different things. The biggest, probably most central piece, was this prevention analysis. So, just as a reminder of what the scope of work and what the analysis scope is that we're working to shepherd through the process over the course of the next few months, is we've been tasked to do a comprehensive inventory of primary prevention programs from school and community based, looking at issues of workforce, what specific interventions are, is there evidence of their effectiveness, what's the funding, what's that funding source, where are their unmet needs. We are tasked with doing some financial analysis as well. I will note that, of course, the Alcohol and Drug Policy Commission writ large, and Annalise and Wes and the team are working on this right now, do conduct regular sort of financial analysis of the substance use continuum writ large, which is currently taking place at the same time. So we're working in partnership to make sure that we're being aligned in doing that analysis on prevention dollars, but we're going to do some additional work around prevention financing and how the services are funded, what those sources are, and really looking for the extent to which are there gaps, are there alignment issues where a particular funding source may not be quite matched with what it's actually being utilized for, or perhaps is really well matched, and we should be collectively thinking more about that. Doing an assessment of the workforce, who's delivering primary prevention services, what are the credentials they have, where are they placed, to what extent are their investments ongoing in improving and expanding and deepening the workforce. There is a specific call out for certified prevention specialists, as you can all imagine, that we're looking into, as well as trying to continue to unpack some of the training and technical assistance needs, which obviously will serve in the furtherance of your broader conversation as a committee around this Center of Excellence hub concept that you're currently doing scoping discussions about. And then lastly, we'll come back with recommendations around solving gaps, rectifying any inconsistencies in funding, or sort of naming some places where this committee, the ADPC writ large, and others can maybe take an effort to undertake some of ways to address some of the challenges that this uncovers. Next slide, please. I want to talk a little bit about the definitional approach, because I think it's something that this committee was really, really keen on. The way the statute is directed, the statute itself defines prevention aligned with the definition that you all have put forward in the comprehensive plan, right? So the definition of primary prevention is what we're using as our guidepost, because I think when you think about doing an analysis of an entire prevention ecosystem, we have to make sure we're all talking about the same thing. And because sometimes, as you all know, there are things that might be called prevention, but maybe they're not, or maybe they're not quite aligned enough that they should be included. So we're following this definition of universal, selected, and indicated and primary prevention that was outlined in the statute. Because we are doing financial analysis, and that includes financial analysis of federal dollars, which very often are tracked or categorized by SAMHSA or CSAP prevention strategies, we're going to do a crosswalk of both. So as we just to make clear that you will see as we move this forward into a final product, our financial analysis and programmatic analysis is going to take a cut that aligns with House Bill 3321, and is also going to identify the extent to which we can match things to CSAP or SAMHSA strategies, so that we have the ability to translate any differences between how the state may describe or define prevention services going forward and how the federal government or other entities do. So I just wanted to name that for clarity's sake as we think about what is included in this analysis. Next slide, please. Again, one of the biggest challenges with prevention that we've been wrestling with and talking with Wes and some of you early on is trying to sort of wrap around like what counts in prevention. A lot of things directly or indirectly can prevent substance use. There are also dollars going towards things that may prevent substance use, but they aren't specifically prevention initiatives, or they don't have a substance use prevention lens in mind as it is funded. So we are gathering a ton of information in a broad swath to look at the issues of prevention, but we're beginning to hone in and focus around services and programs where the prevention of substance use, as defined, is a primary or specifically stated goal of the intervention. For example, after school programs all by themselves are kind of a prevention strategy, right? Pro-social activities, out of school hours where kids are oftentimes left alone, increasing risk of use. But it does not behoove us to do a financial analysis of your entire after school ecosystem. If there's an after school program that is running an evidence-based prevention strategy within its program, that we want to search for. So I elevate that as an example because the last few months have been involving our team meeting with a lot of folks at state agency level at this point, really honing in on what is it that you do, what do you think you mean in investment in prevention, and then how do we understand that in the context of our analysis. And then the last thing, and Debbie, I see your question, is we are looking at not only funding sources that are described as being for the prevention of substance use disorders. We want to look at all funding sources that might be invested in the delivery of prevention services. So that means we are casting a wide net on funding. As an example, oftentimes tobacco prevention and control, this is a group that has elevated some of the inconsistency or questions around how tobacco dollars are or are not connected to primary prevention services. So we're gathering information on on funding sources that may not feel close to the pin around substance use prevention so that we can conduct some actual analysis, again, to identify whether or not there is alignment in places where there might be some differences in view around whether or not those dollars are financing prevention services. We also want to make sure we're recognizing the fact that at the local level, prevention services might be funded by all sorts of funding sources that don't ever touch or pass through the state. And so we're trying to catch a wide swath as possible on the funding sources while trying to be really explicit about the types of interventions we want to look to. Debbie, go ahead.
Yeah, as you were talking, Tim, it actually came up in our training here today, and I'm thinking of this marriage between this work within 3321 and then our Center of Prevention Excellence, that like naming that after school program, we might find out, hey, there's a whole bunch of these, and it does fall under, one of those CSAP strategies, pro-social alternative activities. And it might be this opportunity too for us within our Center of Excellence to be able to say, hey, you can even make it more robust by, being able to go to the center and say, hey, now maybe you can add some emotional literacy, some connection, some education. So I think I'm excited about the possibility. I know they're kind of two separate projects, but even when we have this inventory of, hey, here's people that kind of are doing this work, that will have this ability to help them see, oh, hey, how you can not just do, good, but good, better, and best, because now we have these two things working together. So I just, I love what you're saying, and I think the synergy there is even more powerful than I first imagined.
Yeah, thank you, Debbie. And and I do think we, and there's a piece of this as well in terms of doing this programmatic review, which will become important in a little bit when we dive into some ways we could really use your assistance over the coming weeks. Is that we really, while we want to put a bit of we want to put some guardrails around what we're gonna ask about and what we're gonna sort of report in on programmatically, we are going to push quite actively, particularly as we engage the community around areas where there is innovation. Where do we see substance use prevention, primary prevention, as you all defined it, integrated into other programs or other strategies, and can we elevate those, to your point, Debbie, to be able to lift up some examples where maybe we find some places where on its surface it may not look like there's something substance use prevention specific going on, but there is, and when taken together, it's achieving a better impact. So you will see as we go forward some areas where we're going to start to inquire, particularly among providers, to help us identify some of those places where there might be already examples of integration that should be elevated because they're either proving better impact or an innovative way in which those resources are financed with multiple sources. Ashley, can we go to the next slide? So this is not a month where we have a lot to report back that we've learned, because what we've been doing over the last few months is mostly talking to people and gathering as much information as we possibly can. So we have spent the bulk of the last couple of months meeting with state agency heads and state agency leaders across Oregon government, again, to try and assess and unpack and understand what role, particularly those outside of OHA, which you see here, what role do they play in primary prevention? How do they think about it? Are there services or strategies being delivered within other state agencies that we want to include? And then to begin to facilitate a process to gather some data from those state agencies and other thought leaders in the state. So we've spent most of our time doing that. Wes has been fantastic, the state agent helping us connect those dots. The state agencies we've met with have been generous with their time, really thoughtful in their responses to us. We are still in a gathering mode, like we're still sending out requests for specific information and beginning to build our catalog and database here on the back end. But you can see here sort of the breadth and depth of conversations that we've had up to this point. We are not finished. We have a couple of agencies that we're either having some follow-on meetings with, or we are getting closer to the pin with some individual staff experts that we need to talk to. Obviously, Oregon Health Authority is a large entity, so we've started meeting with some parts of OHA. We have a couple of other OHA meetings in the pipeline to start gathering information from them as well. Next slide. And I just want to give you an example of the kinds of things that we are asking state agencies to provide us as a part of this statute. And first, I also want to thank Debbie and Pam in particular. One of the first things that they were able to do, which was super helpful to us, is share with us a number of sort of just historical documents about the prevention system, prior conversations, documents that state agencies have put out. So we also have a treasure, as we are asking for more recent information from state agencies, because of a lot of leaders on this very committee, we've had the opportunity to build a library of some source materials that have really helped ground us and our team in some of the existing understandings of what's happening in the community, what is happening at state agencies, what messaging various entities or dollars are being put out. But you can see here some of the examples. These are of the types of information we're asking state agencies to provide us. Septerus, so that everybody's clear, and thank you, Debbie, I see your note. We can come back around a key for the state agencies we've talked to. But, block grants, we're asking to see the state's block grant proposal. We're asking to see the state's block grant reporting, any audits that SAMHSA has done on the block grant. We're looking for any materials related to, again, federal grants that the state may have received or state agencies may have received that had a prevention component in it, programmatic reports, summaries, impact materials, contracts, grantee reports. So we are, again, sort of spending a lot of time right now organizing and amassing a lot of paperwork, because obviously I think the biggest challenge in this initiative is not necessarily the dollar work, because again, we're able to partner with the ADPC staff in their financial analysis to sort of get at and cross-check each other with some financial information. But what we really need to dive into is also, well, what are the dollars actually paying for? Are those services effective? What are those providers doing? Where are they located? Are they evidence-based? Are they tribal-based, et cetera? So a lot of these other supporting documents become incredibly important to our process. And so these are the kinds of things that we're asking state agencies to provide. I will note too, before moving on, that we have, because there's a workforce piece to this, as you all know, certainly within some state agencies, there are staff personnel, state agency personnel who might be delivering prevention services in the context of their job. So while what I'm referring to here on this list is mostly contractual relationships with community providers delivering prevention services, we're also looking sort of behind the curtain a little bit around staffing allocations at the state level and workforce issues at the state level, where there might be individuals in positions that would be defined as primary prevention in their scope, and accounting for that as well within the analysis, both financially and programmatically. Next slide. Oh, thank you, Wes, for that update in the chat, the acronym salad. So thank you for translating. The big highlight that I want to share with all of you that is happening literally as we speak is that And in other states where we've done this kind of analysis, getting information from state agencies is important. But what's absolutely critical to reconcile that information with what's happening on the ground is engagement with community. So we are launching over the course of the next 6 weeks a number of surveys. These surveys will be online. We will be asking these constituents to fill out surveys to share with us what programs they're operating that fall into the primary prevention definition, what funding sources they are utilizing, where those dollars come from, what their gaps or opportunities might be, the extent to which initiatives might be evidence-based, tribal-based, promising, or local innovation, and some other questions to really help us get context and reconcile what we receive from state and governmental information with what's happening on the ground. The ability for us to tend to what I think many of you, I'll speak transparently. I know this committee was motivated in part to have this kind of analysis done because there was a perception of disconnect between a sense that there are resources going out from the state level that are doing certain things and whether or not those things are actually happening, or those dollars are going into things as the prevention field would want to see them. So so the K-12 survey, and I want to thank ODE, Alana, they've been fantastic helping us with this, and Wes as well. The K-12 survey launched this week. It may not have hit yet the desks of superintendents, but messages are out and key partners are being positioned to promote that survey that's going out right now. We are also going to conduct a survey. I'm going to get to the provider survey in a minute. I want to hold that one to the end. We are working right now on launching a survey for certified prevention specialists. And we've talked with MACBO. We're talking with some other stakeholders to develop a very brief survey of all the CPSs in the state of Oregon. So I will note, because many of you might have that and also wear two hats. So it is our hope there might be some folks that we might ask to respond to more than one survey, and we really hope people will do that. But we are getting some stuff from the CPS workforce in the state. The other one, and I'll thank Alexis, who I know is on the call, we're working very rapidly to develop a survey for colleges for the collegiate prevention system. We want to make sure that's captured, whether or not state dollars fund it. I know in conversations with the comprehensive plan, and I think Debbie, I recall your discussions at some points of feeling like what's happening at the college level was something that many felt they don't know what they don't know. And so after talking with Alexis, we sort of have an opportunity in a short window of time to maybe do a survey to pull some really key information around what's happening on the college campus level. So we will be doing that as well. And that's going to go out hopefully in the next couple of weeks. If I can go back to the provider survey, and Shauna, this gets to your question. This is where we're going to need your assistance. Our goal is to get this provider survey out to providers in as broad a definition as we possibly can. So, it's a little complicated and in many respects, the information we need, whether it's an early childhood center, a drug-free community coalition, a broader substance use agency that offers a whole continuum of care, including primary prevention, we need the same information from everybody. So our hope is that this provider survey is a one-stop, that as many providers that you would want to see caught in this survey sharing information and perspectives is included in it. So I say that because I think one of the places where we're really going to need assistance and support is making sure that this survey, when it goes live, gets to providers to complete. So that's a place where, we're working with Wes, we're working with other constituents and counterparts to make sure that when that survey is public and live, it's shareable, it can get out to as broad a network as possible so that we can get as robust a response rate as we possibly can, both in terms of the type of provider, but also we want geographical equity. We want to make sure that we're hearing from organizations across the spectrum. So, and that's a place where we're really going to need help and support from within the prevention leadership within the community to help ensure and encourage people to complete the survey. Debbie, go ahead.
Yeah, I'm thinking as you're talking and then with Shauna's question, with the survey, will would it be understandable that some organizations or people might get the survey and think, oh, this doesn't really apply to me? Because again, so that you're nodding your head. So there will be, I'm assuming, some language to help them start to the survey will both be, yeah, we're going to find out where they fit, but we'll kind of almost like a knowledge assessment. Okay, awesome. That sounds great.
Yeah, and I mean, and I'll just use the school survey as an example. Like we called it internally the preamble. So the survey begins with a narrative of here's what this survey is looking for. Here's the definition of primary prevention. If you do work that falls under this definition, this survey is for you. So we're going to do a little bit of educating, and there'll be other places within the surveys as well where we will be guiding people with the kind of information that we're hoping to receive so that we make sure that people feel like it is something that's not only valid for them to complete, but is easy enough to understand that they can go ahead and put in the necessary information. We also, and we did this with the school survey because, as I said, we do want to kind of keep track of where is there local innovation, who is doing something really unique around how they're braiding or blending funding. So there's also there's an open invitation to stay connected with us at Third Horizon and to share their information so that as we hear from people, if we want, we have the opportunity then to follow up and do follow on key informant interviews, or perhaps ask to elevate something as a use case or a case study that we can include in the final report around innovation. So we're going to be looking for those things throughout as we do the survey. Roxanne, I see your question. Would you mind would you be comfortable just coming on and, because will it be primary prevention or substance misuse use primary prevention specific? I'd be curious your definition of that in order for me to answer your question.
Well, so primary prevention, an example would be in problem gambling, we do primary prevention for our prevention work. It's not substance abuse or misuse prevention, but we are doing primary prevention work. And so I want to make sure, for clarification for our providers when they start receiving the survey, et cetera, if they're asking me questions, I can be clear with them.
Yeah, spot on. So thank you so much for clarifying that, because yes, this is substance use prevention specific.
And so I would just say that I think it's really important to make sure that I know it will feel redundant, but I think it'll be important to continue to add that verbiage, so that it's, because I know I hear primary prevention and it's like, okay, yes. And then it's like, I know the goal of this project, but I just think it's important to, continue on with that language. So thank you.
Yeah, thank you. Yeah, and the survey, and again, I'll just elevate our exercise in developing the school survey. Again, we sort of used a number of prompt tools to make sure that we were super clear. Because, similar to a gambling context, there are a number of things that might be sort of in the prevention wheelhouse globally that happen in a school district, but we really need them to be crisp in what they're reporting to us as it relates to substance use. So both in that preamble that will begin the survey, and then with some other guided prompts that will come out through the provider survey, it will be crystal clear exactly what we're looking for and what we're not. The other piece too, I will say though, to be fair, is that, and this is where my team of analysts, some of who couldn't be here today, are going to play a really key role. Whether it's this provider survey or whether it's state agencies that are delivering us information, we also are going to conduct an internal process of data cleaning and review. We fully expect to receive information that we're going to determine is not actually in the scope of this project, and we're going to set it aside. So I also want to just note that we're trying to be, both with the community and with state agencies, efficient and not asking them to overshare beyond the guardrails. But at the same time, I have been in the prevention field for a long time. I appreciate and live in the gray as well as a lot of you do, I know. So we're going to also conduct a level of screening in our analysis to make sure that when we get to dollar figures and programs that we can report out on, that they will be specific to the purpose aligned with the statute. Debbie? And then I'm mindful of time. So yeah.
Yeah. I really appreciate Roxanne's question, because I think and maybe this is it's too late and there's some way to still kind of get this, but yeah, I think sometimes even just in this work, we pigeonhole ourselves in that it's just substance use primary prevention, but we know that behavioral addictions, whether it's gambling, pornography, technology, those kind of all are playing in a role. And Tim, is there any way with still being specific with the task that, and I think Pam, I didn't quite see if you could come off mic and share your suggestion
No,
of some way of connecting those two, because um, I think that's where I think the gambling does such a good job is they weave things together, and we're looking at the disease as a whole. Is there any way to incorporate that? So Pam, I'm going to be quiet. I'm curious. I want to hear
yeah.
what you had to say.
No, Roxanne, I think your question is great. And it brings, like, I'm thinking now, I'm picturing the survey and, you're asked the question, are you doing primary prevention as it relates to substance use? But maybe there's a box that says other, like I am doing primary prevention, but, and then a little box to say, what are you preventing? Because who knows, a year from now, gambling may turn into the pathway for children and blah, blah, who knows, but it would be great to have that information out there.
Yes. And let me clarify that I think there will be questions that will help get at integration for that very reason. So because a lot of it does happen in the same venue. What I want to be, and gambling is a great example, and we've done work around gambling integration in other states. So I think it makes all the sense in the world. And I'll use the collegiate. Again, it's still under development, but in our work around the collegiate survey, one of the things, there is a question that invites the respondent to identify other prevention services that might be delivered that aren't substance use specific, because and explicitly because our experience in collegiate prevention very often is that it is not singularly substance use related, but it's often led by staff who have a broad range of broad prevention scope that is more inclusive than just that. We also, of course, want to be clear on opportunities where the delivery of those prevention services in an integrated way brings integrated funding that better sustains the work. The balancing act that we want to walk, and this is where I think when we come back to you perhaps in June with some preliminary findings, we want to be careful. I would caution against trying to overinflate the dollars that are involved in prevention in the state of Oregon. Given this committee's concern that there is not enough financing going to primary prevention for substance use as described, as defined by the statute, if we cast too wide a net, you're going to have a report that gives a dollar figure that may look much larger than you think it really is. So that's where we are going to we might gather a ton of information and then make some judgment calls to align with the statute and try to stick with what we truly want to represent in this moment of findings without overblowing this report to be about encapsulating the universe of everything. Because in the long run, that exceeds the request of the legislature, and it might put, from a fiscal policy standpoint, substance misuse prevention kind of in the wrong place if you're trying to suggest that there is an inadequate amount of funding that's going towards the delivery of substance use prevention services. So it's a balancing act, and when we come back to you, we're going to ask for your wisdom and insight to make sure we're hitting that balance, because what Roxanne's question is great in this discussion. These are important points we want to make sure we capture, but we want to do so carefully and in the right way so that we don't create a misrepresentation that doesn't get at some of the other core issues that I know have driven this committee's concern for quite some time. So just to sort of put that out there for thinking. I know we're a touch over. Wes, Debbie, are you okay? I know Caroline has a comment. Are you okay if we're good? Yeah.
Let's have Caroline speak, and then we need to move on.
Yep.
Okay, thank you. I just wanted to make sure that in terms of the research that we have done around the risk protective factors, and the pharmacology that's required as part of the certification for prevention, at least in the state of Oregon, is the fact that we've always taught about gambling in terms of using the same neurotransmitters as alcohol addiction. And so I think if we're only going to have this opportunity in order to do the survey, we could ask the questions in terms of who's doing gambling prevention. It doesn't necessarily mean that we're going to be carving out additional money in the future. But when we have always taught in terms of a comprehensive approach to doing prevention work, and the block grant dollar talks about risk protective factors, and it also talks about the 6 prevention strategies, there's never enough money for prevention. And so if you do a comprehensive approach, you are actually dealing with all those behavioral problems, which is substance use, is school dropout, teenage pregnancy, mental health issues, and we added gambling prevention, I think, way back, Roxy, 20 some years ago. I think we should ask the question, because we're not going to be able to address everything once we get that survey, but we're not going to be able to do another survey probably anytime soon. So I recommend that we do ask who's doing gambling prevention. I mean, I think and I understand, Tim, in terms of the fact that we don't want people to then say, well, now we got to carve out dollars. If you do a really good approach, you're going to be addressing all those behavioral issues.
Yes, agreed. And again, we will ask, but we may ask and we may not go as deep in that level of inquiry. What we will want to highlight, and again, this is where I think leverage becomes important. And it's gambling is one example, but there may be others where we are able to identify initiatives where it is integrated with substance use prevention. And because of that and the financing structure behind it, somebody has something that is sustainable. Like that kind of example we want to elevate, but there will be questions that will invite people who might do integrated gambling work or gambling prevention work in general to name that, along with other prevention types of work that might fall outside the definition. So, and then let me just close real quickly, and you can go to the last slide, Ashley, I think, but or we could just take it down. I think timeline is here. We're due back. We will come back to you in June with another update, probably some early findings, maybe a furtherance of some of this conversation. Then we go dark. For July, our goal is to have a draft of this report to this committee in August so that we can get it to the legislature by the deadline required in the statute in September. So it's a pretty aggressive timeline. My big ask of this group, again, is that in a few weeks' time, we're going to have a provider survey launch. And we'll get it out, or Wes will get it out. You'll start to see it show up in inboxes. Same thing with the CPS survey. Anything you can do to forward it in your networks, encourage your friends, as many organizations to fill it out as possible. The only way we'll get really crisp around any findings around discrepancies between what state financing strategy looks like and what's happening on the ground is hearing from providers. And because we're going to be asking for some very specific information like financial information, funding sources, et cetera, an online survey is the easiest way to capture that information. So anything you all can do when we go live with that to shepherd and encourage the field to respond, we would greatly appreciate it. And again, we'll come back in June. Hopefully the survey will happen in the next few weeks. We may, by the time we come back to you in June, have some preliminary findings or observations that we want to elevate for you. And just again, appreciate the opportunity to partner with all of you on this and have you all as partners and champions in this work. So thanks.
I want to chime in with what Tim just shared, because I know we have non-voting members on this. So I'm thinking too, I see Annie, you're here, Roxanne from OHA. Please know, I believe that Tim's talking about you too, and we'll be good with doubling up people. Sarah, you're here representing Chloe. We have some other people, that represent different things. I think it would be, good. We want this, just like Tim said. So I just want to make sure that was not just for voting members, but for us to be as in all encompassing. And then we'll let Third Horizon do the magic of analyzing everything. And I think they heard today some of our questions, and Tim, you were all over it as far as some of our concerns and how you're going to wrap that in. So thank you so much for that.
Darren,
I think
next couple
Darren-
weeks.
Yeah, go ahead, Wes.
Next couple weeks, Darren. Yep. Schools should be filtering out starting this week, but should be filtering out through the end of May.
And to Jessica's question, so just to be clear, the survey language is going out to this whole committee, right? Yeah. And then the funding sources, so there's two, so there's a high level state agency financial assessment that we'll be able to share what the agencies have identified as the funding sources for primary prevention. But the 3321 is probably going to be a little bit broader. Like we're not including tobacco prevention, but 3321, just as you all discussed today, will be digging into that a little bit deeper to think about like how that may be a foundation for substance use disorder. And I know you guys need to move on, but I just have to say real quick, something, a little reminder, like we are the Alcohol and Drug Policy Commission. We're not the Addiction Policy Commission. And when folks say alcohol and drug, they pretty much think of us as focused on alcohol, cannabis, and illicit drugs. So we have to think at the ADPC about what our scope is in order to be responsive to the legislature and the governor. So just a little reminder there. Right, it's all connected. Yes, we know, right, but that's just something for us to think about.
That'll be part of Pam's next legislative agenda. How to take on the world and save it.
Okay. Thank you, Tim. We really appreciate it. I will just attest to Tim's ability to say, give me everything when he's talking to a state agency. So I really appreciate his team's willingness to take on a deluge of information and try to sort it. It's been really, really helpful. And the partnerships is still really strong. So we appreciate everything that you all are doing for this. Getting a lot of kudos too for your work, Tim. So thank you.
Thanks all.
Okay. So I'd like to just refresh where we're at in the scoping conversation. We do not have a lot of time. So we are going to spend a lot of time. We're going to try to make updates next meeting as short as possible so we can continue through the scoping conversation of the Center of Excellence. Just a little bit about process. So, right, these discussions are to inform what you all will be deciding on in a year, right? So we have time. What we are hoping to do in the document that you saw is to note all of these discussions down. This is to Debbie and Luis's point earlier. I know a lot of you process in the meeting. It's because it's a lot of information. Frankly, I talk really fast. Like I know it's one of my personal faults. Like it can be confusing. So I really want folks to take time with these when I send them out and think about it. If you don't want to bring it up in the meeting because you hear something that is a little bit different than what's on paper, come to me, come to Luis, come to Debbie. It is an open door policy, and we will try to reflect it back in this documentation as much as possible. That being said, we are well on course to continue scoping through the summer. And in general, last month we really focused on who the primary audience is of the Center of Excellence. So I am just going to flash this up. You have this document in your meeting invite, and committee members, you got this through email blast as well. Last meeting, I heard three things. One, we need to be extremely cognizant of the existing primary prevention workforce that exists in Oregon now and develop out their capacity. There was a lot of conversation around, well, what do we mean by existing workforce? And so this is what people named in that conversation as kind of the traditional or folks who have been working on this currently or have financing to do what we have been talking about, in which we're talking about the primary prevention of substance use disorder. So, certified prevention specialists, members of the Oregon Coalition of Prevention Professionals, ADPEP, TPEP, ODPEP, prevention coalition members, so broader community coalitions, drug-free communities and federally funded primary prevention grantees, closely connected partners such as priority populations, K-12 schools. That is where you all started to talk about is where we should start as the primary audience, and then we should work our way out to broader communities. So moving down over the next 3 to 4 years, really thinking about serving community-based organizations, early childhood service providers, law enforcement, state and local policymakers. So how is the Center of Excellence helping determine what we do as a committee, and broader family and community serving institutions? And then tertiary, kind of the general public. So any person who has an interest in substance use can go to our website and find some easily digestible pieces. That's not to say that, Debbie, I heard you about to ask a question. Let me finish this last sentence. That's not to say that any of this would not be accessible. We would really strive for kind of that universal, targeted universalism approach in which we're making things specific for a population, but they should serve everybody. So I think that's kind of what we're thinking. But I am here for you all to tell me if I'm wrong. And I think we'll take it from there. And then the second question I'd really like to talk about today is the center's role, and really hone in on the questions around role. So yeah, Debbie.
So when you were talking about that secondary audience, and that's where I really want to reach out to our community members that maybe, that's primary prevention is not necessarily their most obvious job description. But many of you that are like with school, with our CCO, public health, I'd like you to, sometimes it's like, well, that's within HIPCA, but maybe it's, the opportunity to be maternal and child health, adolescent health, early childhood. We really need to hear from you. We've really recruited you because we know you have an expertise and you can help us see things from a lens that maybe is, it's been too close to our eyes. So please, and again, if you don't feel like, oh, I really want to think about this, please share out, because this is that turning point, and you play a pivotal role. So I just want to make sure that was clear, and that they see that, wow, I need to look at this from, if I wanted to do this and I have my scope of work, what would I need to see?
Do folks have thoughts on the audience and the timeline for audiences?
Are we
Yeah,
providing feedback? Oh, I'm so sorry.
Oh, I'm sorry, Lindy. I didn't see your hand up, and I saw Tim come off of the whichever order.
Lindy, you go first.
Thanks, Tim. Just to clarify, Wes, you're seeking feedback on both the primary and secondary audience.
Yes. Yep.
Okay. I definitely have thoughts, but give me a moment.
Okay.
Tim, you can go next. Just wanted to ask that question.
Like I said, if it's something that you don't want to process out loud, that's fine. You can write them down and we will put them in here. Go ahead, Tim.
I just wanted to kind of add on what Debbie was saying, which is, a great note about public health and what we already know and do. And our Family Connects team and nurses that are going out in the houses and have that direct connection and the trust with families. And I'm speaking from a lens of rural Oregon here, which is a lot of Oregon. And so we have our home visiting, we have our cocoon, our early childhood, we have our WIC, we have our preventions. We're going out and outreaching to our unhoused community. So not just depending on our direct prevention specialists to do a lot of this work, but circling all of our teams and utilizing our partnerships in rural communities with, our ORCA, our ADAPT, our, Bay Area First Step is another one that comes to mind. But what does that look like for the Center of Excellence, right? How do we get them to that point, and what kind of services will we provide and support in that? And, is it going to be education? Is it going to be linking them to services and care? Is it going to be areas where they could get funding to bolster up some of their training? Because our prevention system within this organization tries to share some of that, but doesn't have the bandwidth or the availability to do cross training. So I just wanted to throw that all out there as a starter.
Can I ask a follow-up question, Tim? And then maybe we can check in on Lindy. So what I'm hearing is supporting broader public health and behavioral, because I heard like Bay Area, which we, kind of feel in the behavioral health field, but broader behavioral health and public health outreach teams that might be funded to do something that is in the prevention world, not necessarily substance use prevention specific, figuring out what supports they need to interact with community with respect to these topics, and supporting them through some avenue, whether it be funding or some other education process.
Yes, and I think if we were just to say, I say behavioral health and public health because we're in the same house here in Coos County. But you're right. How for our home visiting nurses, our Family Connect nurses, our other individuals out serving the community, how do we make them aware of what to look for, how to talk with individuals, how to get them to services and get them to some assistance? That may be what they're not specialists in that, and they're secondary, but bringing that kind of information and education with the Center of Excellence will give them the tools and the resources to be able to help a broader range.
I appreciate that, Tim.
And if I can just real quick before Wendy, Tim, if I could stand up, or you could see me, and I had balloons and everything. That is my dream exactly. Because a lot of time the prevention specialist might be, I've heard is that we're kind of like the connector, but we're just one person. And even if we have a little staff, we can't get out to all of the people that you're just mentioned already have those connections. So what if there was that evidence-based informed strategies, language that those people that are going out and making those connections with people could have enough information to start to infuse it. And I think that's where we're really going to change things. So I just loved so much what you were saying, and I so appreciate it.
Okay. Circle with Lindy, and then we'll go to Luis.
Okay, I kind of have a lot of thoughts, but I'll keep it brief in that obviously there's so many connections to prevention and other sectors. And so I think being intentional about who our initial primary audiences and then secondary is really smart. But even within what we have listed there, I think there's some room for additions. One of them being, so we specified drug-free communities and other federally funded primary prevention grantees. I think we should extend that to state funded, because there are other avenues that state funding, whether it be a sub-award of federal funding or opioid settlement, for example, there are folks and partners involved in that work that wouldn't necessarily be directly tied to the list of folks we have here. For example, yeah, the opioid settlement goes to ADPEP, but for example, in Washington County, we are subcontracting with at least 5 or 6 community-based organizations that are receiving opioid settlement dollars as a sub-award. So, and those folks are absolutely critical to helping build capacity right now. And then I know there's the OHA health equity grantees, focusing on commercial tobacco cessation, and I think there's a youth development one as well. So I just want to make sure those folks would be included initially. As far as secondary audience, actually walking that back, I think we could have one more item of closely connected partners being our suicide prevention and problem gambling folks. Because at least in the Tri-County, I can speak to that more, there's a lot of collaboration and intersections with substance use prevention work in those spaces. So the secondary audience, I just had a couple suggestions, naming traditional health workers under somewhere in there, which embodies a whole variety of, community health workers, peer supports, lots of different service providers that are working directly with the community and absolutely doing prevention work in different spaces, but maybe not seeing themselves directly right now as doing prevention work. And then juvenile justice, I know we listed law enforcement, and I think within that specifically calling out the fact that juvenile justice is a separate entity and works very closely with law enforcement, but has really, really important insight into substance use, especially among young people. And then culturally specific works. I would like to see culturally specific organizations listed in secondary audience. And that is all.
Lindy, that's awesome. Thank you so much. I will add all of these suggestions. Luis.
Yeah, one more public health voice. I just wanted to also agree with Dr. Lynch's, because we're set up in the same way with our public health system, with our work certifiers and our home health nurses as well, that go out into the community and provide kind of direct services and screening and things. And so I would hopefully have to add somewhere those home health nurses and certifiers and things, because they do a lot of outreach and screening. We're not totally connected sometimes, because when I do ask for certain kind of cross collaboration or partnership, it is kind of difficult within, well, even in public health. But like the nurses would be a good one, home health nurses, the work certifiers, and then to Lindy's point, the cultural specific organizations. And then I do see providers, but I do also want to call out doulas or OBGYN providers as well too, because they do a lot of screening and substance use education to mothers, people that are pregnant. That's it. Thank you.
Thanks, Luis. Got it. Shauna?
Great. I'm just going to affirm what others have been saying too, in terms of naming some different specific roles of folks who are out there in prevention work. So I just added, I heard some of these come up already, just in terms of parenting education and family support professionals, family advocates, family coaches, home visitors, community health workers, and then others that have been mentioned. And something that's coming up for me in this conversation too, from several other folks' comments, are that Lindy, I think you mentioned that sometimes folks may not see themselves in this prevention space necessarily. And some of these folks have been fighting to be named in these prevention spaces for a long time also, in terms of, I've heard from a lot of folks in these prevention spaces, working with families, building family relationships, really fostering those early emotion regulation and management and family connection and healing from past or intergenerational trauma or on that recovery journey in different ways of professionals saying we have to fight to be seen and recognized in this space sometimes. And so some of the role that I see coming out of the center is that hand sort of being extended in both directions of folks both saying, hey, we belong here because this is part of this work too, in serving this foundational work. And the center also saying, we acknowledge that you are part of this work and part of the foundational work that makes this happen. So I think that's a really exciting piece of that.
Sorry, I was on mute. Thanks, Shauna. Darren.
Yeah, not so. I just wanted to kind of weigh in from the FQHC lens. I agree with what's been said before. I don't have too much to add. I especially like that CHW workforce space. I know my FQHC has a large workforce there, and that would be helpful. But I think of at least what the two FQs do down here in Southern Oregon. They do a lot of advertising, a lot of media, and a lot of outreach to the community. And I just think that's something that's already happening in FQHC land. We have budgets for that. I don't know if that falls under primary or secondary, audience. So of course, as the BH director here, I'd want to be involved with our school-based programs and working with our pediatric departments and those kind of things. But I think leveraging some of those resources that we have within our structure to help get the word out and aligning. We do things for like substance use awareness, mental health month, these kind of things. So it's a way to kind of double down and get more bang for our buck when we advertise or promote this type of stuff. So.
Thanks, Darren. Yeah, we got the FQHCs in here on the primary. And I just wanted to name a typo. I had QMHP workforce. It was supposed to be CMHP workforce as well.
Oh,
So
okay.
the CMHPs as well. But yes, thank you. We will definitely add that intersection of traditional health workers and FQHCs. Jessica.
Thanks. I love this discussion, love the additions. I just had this thought. I feel I'm gonna say it here, but I feel like it's a concept maybe that we talk about as we move along. But as we're thinking about these different audiences, the thought around coordination came to mind, and so I just wanted to share, like in my experience, one of the things that helps us go deep with limited funds is the ability to coordinate within a community. And no, I'm not doing everything, but I know, we're part of this greater system that is all kind of marching to a similar mission and vision. And so just wanted to, I guess, mention that concept of the importance of coordination so that we're not unintentionally siloing the communities, and that again, I feel like is maybe a concept as we move along, but it came to mind and I just wanted to share that. Thank you.
I have added that as a primary question for our roles conversation, which I'm going to give you homework to do. But yeah, okay. Thank you so much, Jessica. Amy.
Okay, I'm going to try to articulate my thinking. I'm not sure if this would be like a primary or more of a secondary, but I keep hearing like a lot of like professional organizations and things that and I'm just wondering, I've been sitting in on this echo SUD prevention. And one of the things they talked about from a school standpoint is how powerful our coaches are in educating and providing just kind of less intense or in an environment where it's just natural that they're trying to teach kind of health and wellness kind of things around nutrition, and then they can add in some of the education around the substance abuse. And so I'm wondering if we're missing maybe like the national, like Little League is what I'm going to throw out there right now. Tapping into some of those organizations to provide, most of those provide some sort of training for folks, but just a thought.
Amy, I just did the Little League training to coach T-ball. I was telling Luis this the other day, and we learned all about traumatic brain injury. And so like I see your point very well. And so yeah, I think that's something I put athletics coaches, extracurricular like associations as if to capture that. That's all right. All right, y'all. We are way behind schedule, so unfortunately that means you get homework. I am going to send you the following question to ponder. First, I'm going to edit this. I'll send this back out to you all. I'm going to give you this question for us to discuss next. You've named all these partners. We need to get into the roles conversation. Okay, so you will get this in email, but what is the COE responsible for? That's a big question. So I just want you to process away on a piece of paper, send it to me. I will get everything in a notes document, and then I will try to get themes, and we'll work off of that next meeting. Are there key pillars of scope suggested by Third Horizon? So resource portal, tiered training, rapid response, academic translation. I added Jessica's comment around coordination at a community level. Start to think there and then move out from there. And we will talk about it at the next meeting. We'll devote the whole meeting to that because I think there are other role conversations that will start to be answered by what we get from this conversation. How do people feel? Give me a thumbs up if we're on the right track. All right, great. Perfect. All right, Debbie, I'll turn it over to you for public comment.
Okay. Thank you, everyone. This was pretty energizing. We have just a few more minutes. If you do have public comment, and you'd like on this conversation or where we're going with some other efforts and initiatives, this is your chance to just say, hey, I'd like to speak in the chat. However, we definitely want to hear from all of you. So Wes, I'm on my phone, if you can help me with people that are raising their hands.
Absolutely. Members of the public. Ashley, did you get anything in private message that somebody wanted to speak?
I did not receive anything, no.
Okay. Going once. Going
Yes.
twice.
I'm not gonna call on anybody today, so you're all safe.
She can't see you. That's
But
why.
oh, I can a little bit better. I move my phone. But please, I want to throw out that and if you need Luis's and mine, if we can put make sure that goes out. Members of the public, I don't even like to call you members of the public. Members of the team, please include you. Please know that goes out to you too. We only have so many that we can have on ours, but the idea has always been having a big tent. So if just this little pause has thought some of you like, I want, Julie, I appreciate the thing that you put in the chat. John Epstein always having some key instinct. Again, Roxanne, thanks for helping us kind of look at that full scope. I'm trying to remember who I saw who provided some of that public comment along the road. So
Jessica.
okay.
Hi, I wasn't sure where to insert this, but I just wanted to share that I had the opportunity to be a part of what I understand is kind of reaching out to Oregon through what's called a MAPS process. Which MAP stands for Measures of Accountability to All People in Policy Solutions. And I attended Monday in Salem. There was a conversation, and there is one to occur in Ontario and maybe Grants Pass in the coming weeks. And it was all around, this is phase 2 of their work, in which they've done some analysis in order to create measures as part of the SUD continuum of care. And I just wanted to say it was a really great experience. I'm glad that I got to participate in that. And ADPC's work continued to be a theme in my prevention table. And I didn't know if there was any collaboration or awareness about MAPS with ADPC and kind of that continued work.
Yep, I can speak to that really quickly. And the dates and registration have been in the newsletter for a couple months now. We have collaborated with MAPS and OHA on that since the very beginning. Due to federal funding, the project has shifted a little bit as it's gone, but I believe we will have a report out by this summer, is my understanding from the planning meetings.
Yeah.
Great.
The
Okay.
only other thing is I've connected with a research team to invite them to the space so they could listen in to the things that you all say. They'd come a couple times, but I don't, since you've joined, Jessica, I'm not sure if they've come. So, but they're aware of the meeting. They have it as a standing meeting. They're invited. So yeah, we're trying to coordinate with them as much as possible.
Great. So a lot of opportunity for collaboration. So awesome. Thank you.
And thank you. I'm getting to hang out with Cindy Hillier here. So Cindy and Lindy and Jessica, just a personal and group appreciation for you guys taking the time, the travel time to go and do that. So we really appreciate you guys filling those spaces, because that's what we need to have happen. All righty. I think
We're
it's
on
time.
time. Thank you all. We did it. Have a wonderful
Okay.
month.